Hi Greta.
Hi, how are you?
I'm good. How are you?
Good.
Wonderful. So I see here that we have a 4 o'clock appointment. Okay, perfect. I'm sorry, I forgot to introduce myself. My name is Dr. Mad. I'm going to perform the medical exam on you today. Can you please verify your first name and your date of birth?
Yeah, Greta. And then my date of birth is 11/07/98.
Perfect. Do you have any allergies, Greta?
Just some seasonal allergies.
Okay. But you're not allergic to any medications, right?
No.
Okay. I'm going to go ahead and ask you a few questions about your medical history, and then I'm going to ask you a little bit about your symptoms and what you're experiencing today.
Okay.
Okay, so do you have any hypertension?
No.
Hyperlipidemia?
No.
Okay, any kidney disease?
No.
Okay. Any respiratory problems like COPD or asthma? Okay. Any surgeries that I should be aware of?
No.
Surgeries, okay. Any accidents that I should know about?
No.
Okay, so what kind of symptoms are you experiencing? Tell me what's going on with you.
So I've been really tired lately, kind of fatigued and exhausted no matter how much sleep I get, honestly. My skin's also really dry. So I'm not sure what's going on with that. And then I also am having like some cold intolerance. I feel like I'm always cold, or even if I like put on the heater or something, I still have to like put on blankets and a sweatshirt and stuff. So yeah.
Got you. I understand. Okay, so I'm going to ask you a few questions.
Okay.
To make sure that we're not missing any symptoms, and then I'm going to do a medical exam.
Okay.
So let's see. Are you experiencing any headaches lately?
Not super often, maybe like once a week.
Okay. Any neck pain?
No.
Okay. What about neck movement? Are you able to move your neck in all directions?
Yeah. Sometimes it's just a little sore on the back.
Okay. And are you having any pain on your face?
No.
Okay. Did you feel any lumps or masses in your neck right here?
No.
Okay. How was your appetite? How has it been?
It's been pretty good. Pretty normal, I'd say.
Normal, okay. Did you feel like you're losing some hair?
No.
Okay.
Just like dry scalp, just like my skin.
Okay, so regular. And any weight gain or difficulty to lose weight?
No.
Okay. Okay. Have you been having palpitations or just a rapid heartbeat?
No.
Okay, and any muscle weakness?
No.
Okay. So I believe I have 3 symptoms out of the 10 for possible cause of the thyroid problem.
Okay.
And I'm just gonna go ahead and do a very thorough thyroid exam on you.
Okay.
All the exam that I'm gonna do today is to establish if you have some sort of underlying hypothyroidism or hyperthyroidism.
Okay.
Of course, we're going to go ahead and double check with blood work at the end, but let's go ahead and begin.
Okay.
Are you having any pain right now?
No.
Okay. Any tingling sensations in your arms, hands, or your legs?
No.
Okay. So would you say that on a scale of 0 to 10, your pain level is 0?
Yeah, I'd say 0.
Okay, very good. Okay, so what I'm going to do first is I'm going to check the overall hair distribution, your skin, and your body temperature.
Okay.
Relax. Go ahead and turn your head like this. Just trying to see if there's normal hair distribution all over. And everything looks good so far. Okay. Now I'm just checking your temperature. And your hands, they're warm, so that's good. Okay, so no signs of vitiligo or alopecia and normal temperature regulation. Okay, so what I'm going to do now is I'm going to check your hands.
Okay.
Just relax. Okay, capillary refill is within 3 seconds, which is very good. No redness in the palm. Okay. And can I take a look at the other hand? Just relax. Go ahead. No pulmonary erythema. Good. So the nail beds look good. I didn't see any ankylosing, no thyroid acropathy, so that's good. No pulmonary erythema. I'm gonna go ahead and check your pulse and tremors.
Okay.
So just relax for me, please. I'm going to put 2 fingers and just count. Good. Okay. I'm gonna go ahead and compare both wrists. Okay, so the pulse is synchronizing and symmetric to plus. No pulse irregularity. And I would say that your heartbeat is 79, so that's a good sign. Next, I'm going to check for tremors in your hands. Can you please extend your arms like this with the palms up?
Both of them.
Yes, both of them at the same time. That's perfect. Okay, and just hold it like that. Hold it. Good. Okay, so I'm not noticing extreme tremors. Very good. You can relax. Next, I'm gonna go ahead and check your eyes. Okay, if it's okay with you, I'm going to shine this light in your eyes. It's going to be just for a brief few seconds. Go ahead, look at my nose. Okay, good. Look at my nose. Okay, very good. I'm gonna go ahead and press down on your eyelid and just look down. Good. Good. Can you please look at the light right here? Okay. Just follow the light with your eyes only. Don't move your head. Now I'm going to go ahead and check your peripheral vision. Can you please tell me when you don't see my fingers in your field of vision?
Yep. No.
Good.
No.
Good.
No.
Great.
No.
Okay, wonderful. Now go ahead and cover one eye for me, please. Can you please tell me how many fingers am I holding?
2.
Okay. How many fingers am I holding?
1.
Okay. How many fingers am I holding?
4.
Perfect. Go ahead, cover your other eye. How many fingers am I holding?
2.
Good. How many fingers am I holding?
1.
Okay. How many fingers am I holding?
5.
Perfect. Okay, so I was not able to notice any proptosis or exophthalmos, and your eye movements were normal.
Okay.
No lid retraction and no lid lag either. Okay. So what I'm going to do now is I'm going to check your neck.
Okay.
First, I'm going to inspect with a light. So go ahead, relax for me, please. Okay. I'm not noticing any lumps. I'm gonna go ahead and start palpating. Let me know if you feel any kind of pain.
Okay.
Okay. I'm gonna try to make some movements with your head and neck. Just relax for me, please, and let yourself guided by me. Okay, look down. Okay, and look up. Okay, great. And I'm checking the trachea. Trachea is midline. Okay. And I'm not feeling any kind of lumps right now, so that's very reassuring. Okay, so for this test, I'm gonna have you swallow some water, and I'm gonna try to visualize your thyroid gland.
Okay.
Okay. Just let me go ahead and let air out so I can have a very good visual. Go ahead, start drinking. Good. Good. One more. Very good. Okay, that was good. I wasn't able to notice any lumps while you were drinking water, which is a very reassuring sign. And now I'm gonna go ahead and go behind you, and I'm gonna try to palpate even more, make sure that I'm not missing anything.
Okay.
Okay. So what I'm gonna have you do is I'm gonna have you look up. Oh, okay, just very gently. I'm gonna go ahead and try to palpate the thyroid. The thyroid gland is very small. Actually, it's not even palpable. But in very rare cases, we're able to palpate it. Okay. No lymph node enlargement, which is very good. Okay, wonderful. So I did an initial inspection of the thyroid gland.
Okay.
Size is normal, it's symmetric, no lumps. You're not experiencing any tenderness or no pain. I couldn't feel any lymph nodes either.
Okay.
Okay. Alright. What I'm going to do now is I'm going to oscillate your neck, and I'm trying to see if I can hear any kind of sounds that are coming from the thyroid. So go ahead and just relax for me, please. Okay, good. Everything sounds very normal.
Okay.
I'm gonna go ahead and use percussion to make sure that I'm not hearing any abnormal sounds. So normal sounds. Okay. Let's go ahead and check your reflexes next.
Okay.
So what I'm gonna have you do is just relax your arm, okay? Hold it like this. I'm gonna go ahead and tap. Just relax. Okay. Okay. Good. Okay, so far I am seeing only normal reflexes. Good. Perfect. I'm gonna go ahead and check your legs. Good. Okay. Okay. Good. Okay. Okay, so I didn't notice any pretibial myxedema. That's a very good sign. And all your reflexes are within normal limits.
Okay.
I'm gonna go ahead and take your blood pressure and listen to your heart.
Okay.
Do you have any arm precautions? Like I can't use one arm to take the blood pressure?
No, just one.
So it's gonna go right here. Do you mind holding this for me? Just like that? Perfect. Oh, sorry. Actually, I don't know why it's flipped like that. Okay, like that. Okay, so just relax. Can you please uncross your legs? Good. Okay, so 120 over 69, that's normal. And lastly, I'm gonna go ahead and listen to your heart, making sure that you don't have any extra sounds, no murmurs. Just gonna go ahead and move down, just relax. Okay, so I'm able to hear only S1 and S2. No S3, no S4. I'm gonna go ahead and listen with the bell. Just make sure that we don't hear any murmurs. Okay. I'm not able to identify any murmurs, so no heart irregularities. Okay. Wonderful. So everything looks good except for the 3 symptoms that you checked.
Okay.
And I think you might have what's called hypothyroidism.
Okay.
It's very easy to treat. You would just get like a small medicine in the morning every day, and until we make sure that your blood levels are regulated, you're going to continue to take those.
Okay.
I'm going to send the prescription to the pharmacy. Do you have a preferred pharmacy?
Yeah, just Osco.
Okay, so I'm going to send that prescription there, and you can pick it up anytime today.
Okay.
If you don't mind, just as you step outside, there is a laboratory right on the left, and I'm just gonna draw some blood, make sure that we have the right measurements for your thyroid levels.
Okay.
Do you have any questions for me?
No, that's all. Thank you so much.
You're welcome. Thank you so much for allowing me to take care of you today.
Thank you.